Hello, I'm Dr. Fox. Today, I'm talking about pap test and HPV test. So first of all, what is a cervical smear? A cervical smear, also called a pap test, checks for cancers and precancers in the cervix. It is sometimes carried out at the same time as a human papillomavirus or HPV test. The cervical smear looks for abnormal cell changes, which might become cervical cancer without treatment, and the HPV test looks for signs of the HPV virus, which is a common cause of cervical cancer. Okay, then what is HPV? HPV is a sexually transmitted infection or STI passed by genital contact. It usually goes away by itself, but if it does not, it can cause abnormal changes to cervical cells that may lead to cervical cancer. Many women don't show any symptoms of HPV, so they do not know they have got it. Okay then, how are the tests carried out? They are carried out by a doctor in a clinic. You lie on the examination couch and relax your legs so they drop open. Then the doctor, a tool called a speculum made of metal or plastic, into your vagina so they can see inside as far as the cervix, the lowest part of the womb. They use a soft brush to take away some cells from the surface of the cervix, which are sent to the lab for analysis. The smear and HPV test usually last about 5 minutes altogether. You may have some spotting or light bleeding from the vagina afterward. You will usually get your results between 1 and 3 weeks later, but you should call your clinic if you have not heard back by then. Okay then, why are these tests important? Having a cervical smear test can literally save your life. If cervical cancer cells are found early at the precancer stage, there is a much higher chance the cancer can be treated successfully. Removing precancers prevents cervical cancer developing in over 95% of cases. If your smear does show abnormal cells, the results of the HPV test give your doctor more information about them. For example, whether the cancer may be caused by the type of HPV you have. Okay then, you may wonder if it is painful. It is more uncomfortable than painful, and you will probably feel some pressure when the speculum goes in. If you have never had sex or it hurts when something is inserted into your vagina, ask the doctor or nurse to use a smaller speculum. Okay then, how do you prepare for the test? No special preparations are necessary, but do not touch or use any products to clean the outsides of your vagina apart than soap and water, and just water when cleaning the inside. It is helpful to wee just before the test so your bladder is empty. You can also take an over-the-counter pain reliever such as ibuprofen an hour or so beforehand. Okay, next. Can you have the test during your period? My answer is yes if necessary. It's better to book it for when you don't expect to have your period. But don't miss an appointment just because you are menstruating. Better to have it then than not at all. Sometimes a heavy flow can affect the results, but your doctor will talk to you about this. Okay, next. What do your smear test results mean? Your smear results will say either normal, unclear, or abnormal. Usually test results are normal, meaning that the cells in your cervix looks fine and you don't have to do anything until you are called for your next cervical smear appointment. An unclear result means that the doctor don't know whether the cells are normal or abnormal. In this case, you may be asked to do more tests immediately, or you may be advised to have another smear done in 6 to 12 months. An abnormal result means that the cells look abnormal. This does not necessarily mean you have cancer. so your doctor will carry out another smear test to get more information, either straight away or in 6 to 12 months time, depending on how serious the abnormality looks. If the doctor thinks more urgent action is necessary, they will carry out other tests, for example, a colposcopy or biopsy. Okay then, what is a colposcopy? A colposcopy is a simple procedure which allows your doctor or nurse to get a close-up view of your cervix using a colposcope, an instrument with a light and magnifier. If any abnormalities are seen, the doctor will carry out a biopsy, which means collecting a sample to send away for lab analysis. Okay, next, why would you get an unclear or abnormal smear test result? Abnormal cell changes are usually caused by HPV, but there are lots of reasons for unclear or abnormal result. You may have an infection or inflammation, or there may be benign or non-cancerous growth or cyst in your cervix. For example, hormonal changes. If you're pregnant or going through the menopause, can also change the results, and so can problems with the immune system due to health problems such as diabetes, cancer, HIV, or autoimmune diseases, or the medications you take to treat these conditions. Okay, next, how reliable is a cervical smear test? Generally speaking, the cervical smear and HPV tests are very safe and reliable. However, analysis of your cells can occasionally either find abnormal cells which do not really exist or fail to find abnormal ones which do exist. In the first case, you would have to have another smear and HPV test or a different type of test to check the result. In the second case, this can mean that you delay starting the necessary treatment. This is one reason that you should always attend your smear test appointments. Cervical cancer usually takes between 10 and 20 years to develop, so as long as you are attending your test appointments regularly, your doctor will find the abnormalities at the next test. Remember, the cervical smear cannot tell you whether you have an STI. If you think you may have an STI, ask your doctor to test you at the same time as the smear and HPV test. Some common STIs, including chlamydia and gonorrhea, can be found from cervical fluid, but for others, you need to have a separate blood test. Okay, next, what do your HPV test results mean? Your HPV results tell you whether you have HPV and what type. About 200 types of HPV have been identified by researchers, of which about a dozen have been found to cause cervical cancer, although future research may identify more. Okay then, how can you reduce your chances of getting cervical cancer? There are several things you can do. The most important is to always attend your cervical smear and HPV test appointments so any abnormalities can be found and treated in time. You can also ask to have the HPV vaccine, as most cervical cancer is caused by HPV infection. The vaccine protects you against most cancer-causing types of HPV. You can also make changes to your sexual behavior to give yourself better protection against HPV. Use condoms to prevent genital contact, even if you have had the vaccine, and make sure your partner has the condom on well before there is any contact between his penis and your vagina, mouth, or anus. Condoms are the only methods of birth control which also protect against STIs. Both you and your partner should be tested for STIs before you start having sex and share the results. Sticking to one trusted partner is best, as the more sexual partners you have, the higher the risk of infection. If you are out, protect yourself against sexual assault and unprotected sex by not drinking too much and not taking drugs. Finally, Do not douche, as this removes some of the bacteria in the vagina that are there to keep you safe from infection. Okay, finally, do you need a smear and HPV test if you have had a hysterectomy? Maybe depending on your health history and what type of hysterectomy you had. If your hysterectomy was not due to abnormal cervical cells or cervical cancer, you don't need to have a smear or an HPV test. However, if your hysterectomy was due to having abnormal cervical cells or cervical cancer, then you should continue to have smears and HPV test. If your uterus has been removed but if you still have a cervix, carry on having regular smears and HPV test. If you are not sure about any of these details, ask your doctor or nurse for advice. Okay, thank you for watching. See you soon.